What if we could stop a migraine attack before the headache even starts with acute or also known as abortive medications? This is what we will talk about today. We are going to cover groundbreaking studies on treating migraine during the prodrome phase. So what's the prodrome phase? That's essentially the warning period before pain or aura, if you get aura, that is. And we'll also be discussing something called situational prevention that's changing how we approach migraine management. Now, a migraine attack. Migraine attack has four distinct phases. We have the prodrome phase, which is what we will talk about today. Then we have the aura phase, and then we have the headache phase, and then we have the post-drome phase. Now, not everyone experiences every phase, and that includes the headache phase. But I want to emphasize that the prodrome phase is a migraine attack. So when we are here, we are in a migraine attack. Prodrome is an attack. Aura, headache, postdrome, these are all attacks. So when we are in the prodrome phase, that means the attack has already started. So while I like to refer to it as a warning for aura or headache, it's not a warning of an impending migraine attack because prodrome means this attack has already started. Once we are here, we are in a migraine attack. Now, with that said, the prodrome phase can start up to 3 days before we get to the headache phase. And so what does this entail? What is the prodrome phase? What symptoms can a migraine patient typically experience during the prodrome phase? Well, let's talk about it. In the prodrome phase, there could be mood changes. Now, what are these mood changes? Irritability, depression, anxiety. All of these are under mood changes. There are also physical symptoms that can occur. What are these physical symptoms? Neck pain. In fact, neck pain is something that is often mislabeled as the cause of a migraine attack because it happens during prodrome. But again, we have to remember prodrome means the migraine attack already started. And I have a video on neck pain if you'd like to watch that, and it explains it in more detail. However, physical symptoms, neck pain, that is because a migraine attack started. This isn't because the migraine attack was caused by the neck pain. Yawning is another common physical symptom as well. Also, fatigue. If you have unusual fatigue, that could also be part of prodrome. Now, there are also appetite changes that can occur during prodrome. So what are these appetite changes? There's an increase in cravings that can occur during prodrome. There can also be a decrease in appetite. So it's not only an increase in appetite, some patients may have a decrease in appetite. And depending on the migraine attack, that same person with migraine can have an increase of appetite in one attack and a decrease of appetite in the next attack. So it's not always consistent, but there are appetite changes. There are also changes in bowel movements. So what does this mean? This means constipation or diarrhea, okay? Again, prodrome. And changes in cognition. This is brain fog, decreased ability concentrating. Any changes in cognition can be a warning sign. And lastly, sensory changes. Sensory changes, sensitivity to light, sensitivity to sound, sensitivity to temperature. Now, this isn't an exhaustive list. If you figured out your prodrome symptom, then that's your prodrome symptom. This is a list for you to be able to recognize that some things that you may be experiencing are actually part of a migraine attack. The key is to be able to identify that you're in prodrome, and we'll get to why in a little bit. Now, on average, people that experience a prodrome phase have around 13 different symptoms each, and 72% of these symptoms happen 1 to 6 hours before the headache phase. So why is this important? This is a huge treatment window where we can abort the attack. So it's actually incredibly important to take advantage of this so we don't continue feeding sensitization of our nervous system. So why does this even happen? Well, brain imaging shows the hypothalamus, your brain's control center for sleep, appetite, and hormones, is hyperactive during prodrome. This triggers a cascade of events. The hypothalamus activates the trigeminal nerve system, which releases inflammatory substances like calcitonin gene-related peptide, or CGRP, which we have medications for now. And these chemicals cause blood vessel dilation and sensitize pain pathways. So I won't get into it in this lecture, but it seems different prodrome symptoms correlate with different parts of this process. So some prodrome symptoms can actually occur earlier due to this physiological process. Now, what's even more interesting is the study found that people were incredibly accurate at predicting that they were in a migraine attack before the headache or the aura phase. The most reliable symptoms were light sensitivity. 82% of people had high confidence that headache would follow. Dizziness and vertigo was another high confidence prodrome symptom. So this isn't just random. Your brain is giving you consistent, predictable warning signals as these neurochemical changes unfold. So let's talk about the Prodrome trial in 2023. This tested an early intervention approach. They gave people ubrogepant, also known as Ubrelvy, a CGRP receptor blocking medication. They gave it during prodrome before the headache started. And what they found is that 46% of people had no moderate or severe headache within 24 hours, compared to only 29% of people who took placebo. So that's a 17 percentage point difference. But here's what makes this even more compelling. A 2025 qualitative study found that 80% of people were already trying to take medication during their prodrome phase. So they recognized that they were having prodrome and they tried to abort the migraine attack. And of those, 63% reported that it helped them reduce their headaches at least half the time. The attempt to abort a migraine attack did actually work. So ubrogepant didn't just prevent headaches in that study. It actually improved the prodrome symptoms themselves. People reported better functioning and less disability as early as 2 hours after taking the medication. Earlier studies with triptans like naratriptan showed similar promise. So when taken during prodrome, 60% of expected headaches never develop. Now here's something most people don't realize. We frequently look at the headache phase as the cause of disability from migraine, but this isn't true. In fact, prodrome phase causes significant problems. It has a negative impact on workability. There is an increase in anxiety, increase in stress. There is a negative impact on family life. This has been studied. In fact, people rated neck pain as the most bothersome symptom and light sensitivity as the most severe. So this isn't just minor discomfort. Prodrome symptoms generally disrupt people's lives. Now, let's pause for a minute and talk about the second game changer, which is situational prevention. That is, taking medications before predictable triggers. The best example and the most common example is menstrual migraine. Research shows that taking triptans starting 2 days before your period can significantly reduce menstrual migraine attacks. Instead of suffering through predictable monthly attacks, you can actually prevent them. And guess what? This approach works for other triggers too. Studies during fasting showed that people taking rimegepant, aka Nurtec, from day 1 had headaches only 28% of the time compared to 60% in those who started treatment later. Case studies show success with situational prevention for exams, travel, stressful events, and even social occasions where you know that you may encounter a trigger that can modify migraine progression. So how do we apply this? First, learn to recognize your personal warning signs from this list. You're not just looking for one symptom. People don't usually experience just one symptom. They have a pattern of multiple symptoms that reliably predict their attacks. So we all have an increase of appetite depending on a specific day or a decrease in appetite. It's not about one particular symptom. It's about the constellation of symptoms. So while individual symptoms might not always predict an attack, experiencing multiple symptoms together significantly increases the confidence that an attack is ongoing. So what's important here? Work with your healthcare provider to develop a plan, an early intervention plan that can address the prodrome phase. This might include having medication ready for prodrome treatment or using situational prevention around predictable triggers. Many migraine patients are unsure when to take their abortives for migraine, and this makes sense because there's a lot of confusion in this area. Well, it's actually different from patient to patient. It depends on the timing of prodrome symptoms relative to headaches and also the type of medication. So it's important to create a customized plan with your neurologist. Lastly, we need to be careful about medication overuse headache, or what is better known as medication adaptation headache. Taking some acute medications too frequently can worsen headache patterns, so proper guidance on frequency is also essential. Now, if this was helpful, like and subscribe for more migraine content. Thank you.